Amazing, still watching Volume Up, and my name never changes. Flight captain to this Volume Up flight, and my name is Simeo Sebukulu. Aboard is with me Dr. Hafsa Lukwata from the Ministry of Education. Ministry of Health. Why am I speaking education? I think because schools are still closed. But Ministry of Health, and she is a mental health expert, but also, allow me to say, commissioner.
Commissioner, mental health,
absolutely. Yes. Absolutely. And I have Mr. John Mary Sekate, who is National Coordinator for the National Association of Social Workers of Uganda. Now, back to you, Dr. Hafsa.
Yes.
Government has been speaking COVID-19 vaccine, and we have seen AstraZeneca, Pfizer, people at some point and all those others. Yes. Should we expect to have a mental health vaccination coming through?
Okay, so maybe we should first understand what a vaccine is.
Okay.
I think a vaccine is mainly, we've known it to be a chemical that that is given to prevent a disease or to control it or something like that. So when it comes to mental health, we shall not use a chemical this time round, but the talk therapy and yes, the talking basically, and preparing the mind. For us in mental health, we are really caring for the mind and what goes on in there. We'll not use chemicals. We shall not use any drugs. But if we talked to people, if we prepared them, there's a Uganda saying that Chijomanyi chinyaga mitono. Once your mind is prepared for something, when it happens, it doesn't shock you. That's why we do counseling. That's why, if in case you're seeing your parent dying, once we talk about the bereavement, I mean, we talk about preparing for the eventuality. People who are prepared, there's a way they go through it somehow more comfortably than those who were not prepared at all. So that's what we are trying to do for mental health in COVID. We are educating people about what they should expect, what they should do in case something happens, like in case you get the COVID, what should you be able to do? In case your relative gets it, what should you do? And by the way, we shall also be, when we do the vaccination, that chemical one, it is an indirect way of preparing our minds as well. And the information that we give during the vaccination is also very important, because we let people know that once you're vaccinated, once you're given this vaccine or whatever, you may get ill. That doesn't stop you from getting ill. However, you'll not get the severe disease, and you may not also require hospitalization, and your chances of dying from that particular disease are also much reduced. So when we tell people that, I mean, there's a way it comforts them. And in so doing, I think we are also offering the vaccine for mental health. So what I'm stressing is that with mental health, it's mainly talk therapy, it's mainly preparing the mind, it's preparing through different ways, even experiencing. Once we make people experience certain things, we've all gone through situations, and that alone is a good teacher. Once you experience something, you become hardened. We've become hardened.
Doctor, so, I have a 90-year-old grandmother that lives in a village. Should I expect that she'll equally be reached by a professional deep down in the village for this service?
Oh yes, she could be, by the way. Now, by the way, there's a good thing that COVID has done for the mental health family. It has made us more accepted, more widely known, more, like we've come out actually. We've also made ourselves feel like we're now very important, and we've come out very vividly. So it is possible that that 90-year-old person now can be reached than it was going to be possible some time ago. So yes, and there's quite a number of things we tell those ones. First of all, they're about to die. That's a fact, and they also know it. By the way, they keep singing it. I should die. I should die. When am I dying? All my colleagues have gone and died, and I'm the only one remaining. So we just tell them that yes, you're going to die. But, well, you should die honorably, and you do not have to die from COVID. You can you could die from your sleep or for any other thing. So there are ways that we prepare different people for different things. You talked about the 45 million people that we care for as the mental health program and the Ministry of Health. It is true. Mental health is takes on the whole spectrum of life, from childhood to adulthood, again to when you're in your elderly years, 60 plus. When you're very young, we talk to you indirectly through your parents. a child is supposed to be taken care of properly, because some of the, in fact, John Mary was talking about it, some of the triggers of mental illness is poor upbringing. Or, wow. Yes, poor upbringing, if your parent doesn't eat very well, for the parents that are using drugs, for the parents that are absentees, you know, we have some absentee parents. All those things are going to affect your child's mental health later in life, or even at that time, but also later in life. So there's a way that we care for people at that age, and it is about talk therapy. We remind the parents of their roles, we remind the parents of what they are supposed to eat and not eat when they're pregnant, or when they are nurturing their children, when the children are growing up. And then for the adults, of course, we talk to them. Generally, these ones are the ones who get the illnesses and so on. But also the elderly, as you've just asked about your 90-year-old, yes, we tell them what they've not been able to achieve. We let them know, and we comfort them in that area, but also let them know, prepare them for, the eventuality of death.
Absolutely. John Mary, Dr. Hafsa brings in a very important category here, an element of child upbringing. Now, we have seen a rise in the cases of teenage pregnancies. How did we end up here?
Maybe before you comment on that, I wanted just also to add a voice on the central role of psychosocial support in this situation. You talked about talk therapy, but for us as social workers, remember, social workers, we are experts in behavior change. One of the biggest challenges we have faced as a society now, because initially the government and all other stakeholders were looking at COVID as more of a medical issue, and therefore, and also a security issue to enforce compliance. But as they went on, they have realized now it is more a social issue, a behavior issue, and a psychosocial issue. And therefore, for us as social workers, what we always do is to enforce and also promote what we call behavioral therapy. That is, we promote positive behavior while discouraging negative behavior that can expose the population to COVID-19 spread. And it is one of the biggest challenges, because people's behavior, it goes back now to the family, what Charles been trying to say. How you behave at times also has also a connotation on how you have been brought about. So that is where the biggest challenge and the emphasis, and my call to the ministry and all other stakeholders, is to work with experts of behavior to design models that can help people. There are approaches for us we use that can help. I've passed in the town and all people are not putting on now masks. People are so close to each other, and that is all. And so there is a need for us to emphasize what is the consequence and what do you gain when you do this. And the messages should be packaged in that line. But coming to your question on child pregnancy, which is at increase, actually it is also a disapproval of parents. The parents, one would think that since now parents are with their children at home, they are being protected and they are giving them quality time. But this one, the increase in teenage pregnancy across the country, one district reported over 1,000 teenage pregnancy in 3 months. Tororo and some districts in northern Uganda and Lyantonde, the situation is running out of hand. So the generation of young people, young mothers, and the engineers that will be Dr. Hosfer in the future are being tainted during this time. The concern for us as social workers is, yes, as social workers we are on the front line fighting, and we need support. We need to work closely with the government to say that, because we have now structures across the country, in all regions of Uganda, so that we put teams that can work with to empower community. We believe that community is an agent, is a catalyst of change, agent of change, and is a resource of change. So they should be taking a lead. First of all, yes, they are taking a lead in, we have been training them to take a lead in responding to COVID-19. But what about other challenges that come with COVID-19, like a teenage pregnancy? They need to be working, like how you see now what has happened in Masaka, that they are creating some, every sub-county, they are creating now a task force to respond to security. We need to create task forces in each and every sub-county, parish and sub-county to respond to this challenge. But after being empowered and also trained. the challenge of teenage pregnancy is worrying. And when you look at the report, 2018 report, Violence Against Children report, it shows that the abusers of these children, especially sexual violence, that leads even to teenage pregnancy, are the relatives, are the people who are close to them.
Those that are known to the
Yes.
relatives.
Yes, uncles, and at times we have seen even parents, real parents, sleeping on their children. So it is a big challenge.
How did you receive the news of the increasing and exacerbating rates of teenage pregnancies among the children, at least you as a ministry?
Yes, as a ministry, and first of all as an individual, it is very, very saddening. It means a lot. It means that we are going back in those days before we came on with the Hafsas, you know. Yes, we found that generation when, like, our parents were giving birth at the age of 17, 16. That's that normal time when they were actually getting their firstborns. And it was normal, it was okay. But then that second there's a generation, our time, when we came in, it was like, it's better to be at school. You do not have to engage in, you know, in sex when you're still young, and if you have to do it, then you use a condom, generally to prevent both HIV, remember we were in that HIV era, like to prevent HIV, but also the pregnancies, the unwanted pregnancies. So now we are back into those days, and what that means is the girl child may not achieve the potential that they were supposed to if we don't do anything.
In life, at least.
At least in life, yes. They will be having a baggage. Can you imagine having a child at 18 years? I remember myself at 18, I was still young. I felt I was still, you know, I wasn't yet ready for anything. But now you imagine you have a baggage, even if you have your mother on you. Remember, the parents are also dying of COVID. So in the event that your mother or your parent dies, then you'll have this baggage on. Even if you went back to school, you will have to do certain things in order to care for your child, but also to care for yourself as you're in school. So they are having a double, you know, problems, and we need to I think, get some strategies to help these children, because it has happened. They're not going to die. Many of these children are not going to die because, first of all, we are vaccinating against the killer diseases, so these ones are going to survive anyway. But the problem is, now there's this mother who is not going to be around, because
at least our life expectancy rate is
also increasing. Yes. So it means that this child who has been brought up by this child mother may suffer, because they'll be growing up in a certain situation which is not the ideal. It's not the one that would have loved, you know, because now they'll either go to the judge's home or to an uncle's home as the mother goes to school, and most of the time even the fathers are still very young and they cannot even take care of this child. So there's going to be a problem with that generation, because they're not going to get the kind of care that they would have gotten with being there with their parents. Then the other thing is the education. I can't imagine where a parent will pay for their child, but then they'll also have to pay for their grandchild, because the parent is not yet able to take care of this particular child. So there's going to be a bit of burden onto the parents, towards the parents now who are giving back, who have these young adolescents who are getting children. We are going to have a strain. It's going to be strenuous on us to take care of another generation which is not even yet prepared. We are not ready for that generation, and that is a very big problem on my side as a mental health provider. I think we need to do something. Many times we keep quiet and we just let it pass, but I think in this situation we are not going to allow to let it pass. Otherwise, we are going to take ourselves or our generation into another ditch somewhere, and then we shall have issues there that we shall need to take care of later in life.
Maybe 20 years from now.
Maybe 20 years from now, even less. Maybe these children, actually, there's a belief that once a mother gets pregnant when they are early, when they are still young, chances are that this child also who is produced at that time is also going to have an early pregnancy.
Absolutely.
Yes. So the chances are there. So like we are going to get back into those days when we are having those, the early pregnancies, and of course the population will be so big. We are going to have increased population, because now if someone starts giving birth at 14, you can imagine how many children they'll be able to have.
Uganda's fertility rate is at about 5.5.
Yeah, but we've come from quite far. We were 7.9 at some point.
Wow.
Yes. So now if we're 5.3, and the reason why it went down is that because the mothers now are beginning to have their first children, at least when they are little, older, like 25 and so on. But now when we go back to 14, a 14-year-old, by the time they become 17, they become 18, 19, they will have given birth to quite a number of children. And many times it will be extramarital. Now, when they get into proper marriages, then they'll also have to deliver during that time of it. So the number of children are going to be quite many. And given that even the number is still very big, by the way, we have a very young population. So you can imagine if the 17 million people, if they all decided to give birth to more than 2 children, that is an explosion into of the population. So there's everything to care, there's everything to fear about the teenage pregnancies that are happening.
Imagine having a network of children giving birth to children who will give birth to children. What's headed for our country? Mr. John Mary, our time is fast spent, but in a minute, I want to pick your thoughts. Some people have attributed this to the closure of schools, and some have said let the schools be open so our children can be engaged in education. What is your stand as the National Association of Social Workers?
Of course, after the president gave the country guidelines that for children to go back to school, all teachers should be vaccinated first to protect the children, I think that was a good step. But maybe where I see gaps is like the delay of the vaccines, like to immunize all teachers. That's where there is still a question. And since the doctor is here, she will tell us when they are going to finalize all that across the country. But I wanted also to give some information on what doctor was talking about. Uganda has the youngest grandmother, for your information, in Mayuge. There is a younger girl who produced about, I think, 13 years. And then she produced a kid, and also that kid got pregnant. What we were talking about. I think I needed to cross-check with the Community Development Office in Mayuge to give you the real information.
Well, the Guinness World Book of Records must be looking for this fellow.
That is a shame. Every leader who is listening to us in the country, these children will ask the leaders where we are when their generation is being spoiled. We are having a situation where, like now across the country, each district now the minimum you can find is 300 young people who have gotten pregnancy. I think we need now to do a national survey with the Ministry of Health through the regional referral hospitals and all hospitals of those who visit hospitals to seek treatment. But you need to know that there are those also who don't go to the hospitals because they capture data for those only who go for treatment to seek antenatal care. But there are also those who don't go there. You may find that the situation is even out of hand. So there must be a plan for these young people. We are looking at girls in relation to sexual violence, but also HIV, they have been infected with HIV, but also the young boys who are now left school and now they are under child labor in the streets, are also surviving. And by the time you tell them to go back to school, they have already lost interest.
Okay. Do you think we are set to reopen schools? Our time is up. I just need your thought.
Yes. When you look, actually, we are having a meeting today with the Minister of Health and the Minister of Education. We are part of that to share experience, and then we are ahead of reopening. But the best thing would be to open schools. In my view, and then these children are protected. They are more safe in schools than at home. Research has shown. Yes.
But that's a shame because really parents should be the ones to take care of their children. I mean, we should take responsibility as parents to do certain things right. We are all at home. You can imagine, we are all at home.
Absolutely.
You'll be the same. I mean, that's the same way as a teacher is with us, with the child at school.
Absolutely.
And they have so many children. So really, as parents, for me, I find this a very big challenge. Like, if you cannot take care of your own children, and especially the girl child, there's a way you can tame these people. But anyway, let me not condemn people, but I think it is a shame. It is a big shame for us parents for having failed to take care of.
It's a shame to the government, it's a shame to everyone, and also to the parents.
Absolutely. Ladies and gentlemen, our time is fast spent. Allow me give a second to each to close it up with probably a tip on how you can better your mental health in this time. Let me begin with Mr. John Mary.
Okay, for us, we think what is the most important thing now is, first of all, to follow the guidelines, continue putting on your masks, continue distancing, continue protecting your family if you don't have to go into those gatherings, weddings. I've seen weddings which have resumed with no masks, which is a pity, and it is organized by leaders. I'm sorry to mention, Honorable Nsereko carried out a wedding last weekend, and there was a lot of people without masks. I thought the government would intervene immediately. So it worried us. So, but we're encouraging people to continue protecting themselves and their families through following guidelines. Yes.
Okay. Dr. House.
Yes, for me as a parting note, I want to let people know that everything is here for a purpose and it will end. Chija kubwa. COVID chija kubwa. We should think through it. We should remain calm. We should think about our mental health, because it is very important to remain calm and steady, because then we shall be able to see that tomorrow. If we react in a very bad way, then the effects will also be very bad, and we may not be able to survive tomorrow. So in case you want to talk to someone about mental health, kindly call the numbers that are running out there. There's a toll-free line, 008 00 212121. And then there's another one where you can call *252 *10#. Those numbers will help us to, you'll get someone who will help you, to comfort you, to talk. You'll be talking to a counselor. So I urge everyone to remain calm, be spiritual, pray to your God, stay with your family, love your neighbor, and as you love yourself. Thank you very much for this.
Absolutely. Now you have no idea how painful it gets having to end an interesting conversation with mind-blowing guests that I have on set tonight. But the last I checked, they both live and operate in Uganda, and since we also live here, they'll not hide from our cameras the next time we need them. Now guess what? Whereas we are touching base tonight's Volume Up flight, allow me tell you that tomorrow yet again I'll be here with Miss Elizabeth Okello, the president of Uganda Counseling Association, and Mr. Banji Venecio, who is a social worker and lecturer in Kyambogo University. Now be sure to catch that as well, because they'll be here to speak psychosocial support amidst COVID-19. Tough times for us all, so let's get ourselves securing our mental health. That way we will live in peace. Now this flight touches base right now, and it's me, Flight Captain Simeo Sebukulu. How about I see you tomorrow?